What is a no-knife facelift and does it actually work? I get asked that question a lot. Now, with any cosmetic procedure, we need to think about the right sort of person for the right sort of procedure. So an initial assessment is really important, and for the right people, we can get amazing results with what we call a no-knife facelift. Now, what is a no-knife facelift? Well, it's a procedure in which we can reposition the normal tissue into a more youthful positioning. In other words, as we get older, our faces tend to drop downwards and forwards, and what we are looking to do is to reposition those into a more youthful position. How can we achieve this? Well, there are a number of ways of doing this. Placing fillers strategically to give support and lift is one way of doing that. Another way is by inserting sutures, which actually have cogs and they latch on to the subcutaneous fibrous bands, and we can then drape the tissues of the skin and the subcutaneous tissues up and raise those tissues. More permanently, we can use non-dissolvable threads to go in through tiny holes, and what we can do is we can anchor them through the deep fascial planes and hook them around or thread them around the tissues to gather and lift the deeper tissues. All of these are going to give an effect. So in summary, a no-knife facelift is usually a combination of fillers, biostimulators for skin and the tissues, which regenerate the tissues and the skin, and thread lifts. My name is Dr. Aamer Khan. My background is that I was in medicine for 20 years before coming into the aesthetic industry. I've trained as an aesthetic doctor and also as a cosmetic and aesthetic surgeon. We started our clinic about 20 years ago in the Harley Street district, and we were in Harley Street for at least 14 years. Now we're providing our services from Devonshire Place. We carry out all sorts of treatments, anything from skincare all the way through to full surgery. We also look after people's general health because we have a philosophy that our patients are at the centre of our care programme. So we give advice on how not only to look good, but also to feel good internally. We have a team of people who work together, providing you with the best possible advice that we can give. Another question I get asked is, who is the no-knife facelift most suitable for? Well, it's really suitable for when we see those early signs of facial aging, with volume changes, a depletion of volume in the midface, a droop of the jowls, and a bit of laxity of the neck. So this normally is people in their 30s, 40s, and possibly in their 50s. When we start looking at people in their 50s, there's more loss of collagen in the deeper tissues, a greater degree of sagging, and we're starting to look more towards the surgical side. But there's that fine overlap because everybody's different, they have different genetics and different features. So there are some 50-year-olds where a no-knife facelift would give amazing results, whereas there are other 40-year-olds or 45-year-plus olds who have too much sagging or too much heaviness where the no-knife facelift just wouldn't work. So how does a no-knife facelift work? Well, what we've got to think about is the tissues that we're targeting. We're targeting the skin, and we can bioregenerate the skin with biostimulators or treatments which actually cause disruption like lasers and Morpheus 8. Morpheus 8 is a great treatment for tightening the skin, lifting it and rejuvenating it. So addressing the skin is really important. The second layer is really the sort of sagging of the skin and the slightly deeper tissues. Well, thread lifts will help to reposition that and to lift that and give it support, as well as stimulating the skin to regenerate a little bit. And then finally, the deeper structures, the fat pads, the loss of fat, the volume changes that happen, well, they can be addressed by lifting and repositioning those and replacing them with fillers and volumizers. And of course, we also see an increase in the gel fat pad, and we can use peptide injections to reduce the amount of fat in those areas without having to dissolve it. So what are the pros and cons for a no-knife facelift? Well, the pros are quite simple, that it's carried out under local anesthesia, it's a day case procedure, people can normally go back to their normal life afterwards, unless it's thread lifts, and I normally recommend at least 24 to 48 hours of taking it easy after that. The cons to this sort of facelift is that it doesn't really replace a surgical facelift. When a surgical facelift is required, then only a surgical facelift is going to give you the results that you're looking for. So it's not an alternative to it, but it can be used before a surgical facelift becomes necessary. The other downside is that a surgical facelift can last 7 to 10 years, maybe even longer, whereas a no-knife facelift will last anything from 6 months up to 2 years, where the threads can last 2 years. And of course, in skins of colour, it can last a little bit longer. So what can you expect from the clinic if you're curious or inquiring about a no-knife facelift? Well, you will first of all make contact with the office or through the website. You will be given an appointment to come and see either a doctor or a skin specialist to discuss the procedure. You will always see a doctor before a procedure is carried out. You will have a full consultation to establish whether you're suitable for it, whether there are any side effects, and talk through exactly what the procedure is, what it involves, what are the pros and cons, what are the side effects, and what the aftercare is going to be. Once you've had that done, then arrangements will be made for you to come and have the procedure. If you're having filler, then that's quite straightforward. That would just be coming in, having some local anaesthetic, and having filler placed in the areas where the doctor has decided to place them. If you're going to have a thread lift, that's a little bit more involved. You'll need to come in, there'll be topical anaesthesia applied to your skin, and then some local anaesthetic injected into your skin. This procedure has to be carried out in a sterile environment where the doctor is gowned up and a sterile technique is used, because we're placing threads in your skin which can increase the risk of infection very slightly. So it's really important to minimize that risk. You may also be given antibiotics following this procedure. If you're having Morpheus 8, that procedure is carried out with local anesthesia, and there is a little bit of pain and discomfort associated with it, and you will have a little bit more downtime because you'll be a bit red and flaky after the procedure. If you are looking to find out more about what you can have done and how you can improve things for yourselves and want to come to a well-established, trusted clinic, then please contact us through our website or give the clinic a call on the number shown.